Hello.
Hello.
Hey,
How are you?
Good. How are you guys?
good.
Doing good.
All right. So welcome to Graduate Testing 101 with emphasis on the MCAT. My name is Emma Barnes. I am pleased to introduce Jacob Roper, the Pre-Medical Club's president and Associated Student Incorporated Director or NSME at CSUB. We also have Dr. Jesse Bergkamp, an associate professor for the Department of Chemistry and Biochemistry at CSUB. Thank you both for joining us.
Yeah, you're welcome. Yeah, thanks, folks. I'm Dr. Jesse Bergkamp. I have asked Jacob to join me because even though I have the doctor in front of my name, Jacob honestly knows a lot more about this exam than I do. He is the Pre-Med Club president, so he's been inviting quite a few folks, to give presentations. You're going to be taking the MCAT.
Yeah, I'm trying to see probably in January. If not, then at least like May or June, which starts to make me shake a little bit. So
the MCAT is definitely in his future and on his mind. So that is the reason why I invited him here. But basically, what the MCAT is, it's very similar to the GRE for graduate school. It's basically the exam that any medical student is required to take. And I've heard that the GRE is actually a little bit harder than the MCAT. I think the MCAT is more difficult because of the length of the overall exam, but we'll get into more of those details. As you can see here, some of the bullet points of the MCAT. For those of you who like multiple choice, it is multiple choice, so that is good. One thing that I have heard about the MCAT, of course, correct me if I'm wrong in any of these, Jacob. I've heard students say that the process of elimination and finding the wrong answers is actually easier than trying to search for the correct answer first.
yeah, so it's part of those critical, I want to say critical thinking skills, but really it's just good test examination skills. I think we learned those in high school. So if you think back to your high school days, they always talk about, if you have multiple choice and you read through the question, look at the questions in terms of trying to find the wrong answers, because that's going to help you as much as trying to find the right answers. And so there's a lot of test taking strategies that are used and are promoted for using the MCAT. And then also that's kind of going to be highlighted a little bit later on this PowerPoint presentation. The MCAT is designed to critically think, and they want you to problem solve. The reason being because if you're going to be a physician, you want to be able to look at the patients and diagnose them and use critical thinking skills in terms of what's going on with the patient and try to understand what are the causes of illness, how to treat that illness, and how is that going to impact the patient elsewhere. If you're going to prescribe them a medication that's a type of antibiotic, is it going to have detrimental effects, say, to their teeth, where it causes erosion? There's a different kind of portion of the MCAT that focuses solely on your critical thinking skills. Basically, the MCAT is used in America, Canada, and Caribbean schools, and that's how they kind of gauge the knowledge that you have to be able to enter into the program. It's used through allopathic and osteopathic schools. Allopathic is more your standard MD medical doctor. That's when you think of when you go to the doctor and they go ahead and prescribe medicine for let's say that you have a broken ankle or whatnot. They prescribe you the medicines. Now, osteopathic doctors have gained a lot more traction, and that is because they practice in medicine solving, where they use medicinal chemicals, compounds to try to treat the ailment, but then they also practice in manipulation of bone structures and muscle structures to try to see if they can fix the issue rather than masking the issue. So there's different philosophies in that. So it's used for MDs and DOs. January and March through September is when the testing centers are going to allow you to take the exam, because it is very strict. We'll go about the rigorous process of taking the MCAT, but it's a whole day thing. And some people will even get a hotel the night before because it just drains you. And then, it's just a long process, and we'll go through that. But registration opens October 25th and 26th for the January through June testing dates.
Yeah. One thing too is, be mindful that this is not the type of test that you can just take when you're ready. You have to match the schedule. So you do have to be proactive and really kind of plan out what dates and what month you plan on taking that exam.
And to your point, I think a lot of students are so used to, oh, I have a schedule. This is when I'm going to take my first organic chemistry quiz or test. Whereas this is you have to take time out of your day to take the exam and plan it, several months in advance. You have to look at your schedule. So there's a lot of planning that goes into this. To move on, what is on the MCAT? The MCAT is consisted of biochemistry, biology, psychology, sociology, critical analysis, and reasoning skills. And this is called CARS, and we'll get into the kind of the CARS section. And then we have chemistry and physics. So I kind of went over, and I've been able to, from reading different passages, from even looking on Reddit and looking at what Reddit conversations with different people had with each other, from talking to students here on campus that have already took the MCAT. This is a collection of kind of basic things that are going to be on the MCAT and some of the high yield topics. So for example, the biochemistry and the biology of cellular system, Krebs cycle, the glycolysis, gluconeogenesis, glycogenolysis. So all these are metabolic pathways, but you want to know the enzymes that are involved. You want to know the intermediate molecules that are in each of these steps, because what you want to do is you want to have a nice overview understanding of, like, let's say the Krebs cycle. You want to know when like alpha ketoglutarate is at which position and which enzymes are going to convert it into the next step of the process. You want to see when pyruvate comes in and what's going to happen to pyruvate. It's good to take classes in these fields so that you can have a good understanding of these metabolic pathways, but a lot of it is studying on your own. So like psychology and sociology and the biology of behavior. So that's like talking about the glass ceiling. That's talking about privilege. It's like the glass elevator, which is talking about how men that are Caucasian or white in color are able to excel in the men of color in fields. And then like the glass ceiling is talking about women, how women are able to excel in their work and the structures of like society. So a lot of the concepts are like introduction or introductory classes. If you take them here at CSB or wherever, like psychology and sociology and the concepts, learning and memory is huge, motivation, emotion, and then psychological disorders, because you want to know all of this for medical school as well. And then sensation and perception. What is perception? What is sensation? How do you view things? How does someone else view things? You'll get passages on the MCAT where it says, they want to know what type of disorder is happening or what type of perception is this through the passage. So then the next one is the critical analysis and reasoning skills, the CARS. And this is really, if you go back to the SATs where you're just reading a passage and you answer the question, that's basically what it is. But again, it's that critical thinking skills and that analysis, breaking down what's going on in the passage. A lot of people find that this is the easiest, but it is the most draining because you're constantly reading. So this one's the one that will tire you out because you're reading through the passages. So there's skills so that you can look at the question first and then try to find the question in the passage to save you some of that time.
Instead of reading the entire thing?
Yeah.
Okay.
And so there are different ideas, different philosophies, how to go onto the MCAT, taking the test and the strategy. And then chemistry, electrochemistry. So this is like general chemistry at this point. Calorimetry, titration, mechanism, and schemes from organic chemistry. So Dr. Bergkamp, I know you're probably excited for that. I talked to some individuals that said they had no organic chemistry.
I know, it makes me sad.
And then I talked to some and they're like, oh,
it was very heavy.
Yeah. And so that's something to realize too, is the exam is not adapted, but it's randomized per person. So that's why you see some people are disgruntled with the exam because they feel like, oh, I got tested really heavily in physics and, maybe I didn't study up on my physics as much, whereas this other person, they didn't study on physics, but they had no physics on their exam and they got a higher score. That goes into part in playing into the MCAT, and you want to know everything, but it's always hard to know everything. So you just want these core subjects, the high yield topics to be covered.
Yeah, it's kind of that, like analogy, a mile wide, but an inch deep.
Yes.
You really want to know the main surface of the key disciplines: physics, chemistry, biochemistry. Of course, by the time that you're going to be taking your MCAT, I would assume already that most folks are going to be either done with one semester of organic and at least maybe going into biochem and so forth. So you will have already had the basics to get you through the MCAT.
Real quick, I just want to touch on physics. Fluid dynamics is very important for the MCAT because that's going to be applied for your arteries and your veins and your capillary structure. So that's why fluid dynamics is very important to know. And the basic lab skills that you learn from your general chemistry classes, and even if you take a OChem lab, those are very important as well. We have the breakdown of taking the MCAT because I think structure and knowing what's going on with the MCAT is very important, and test day. So when you walk into test day, from individuals that I talk to, it's very serious. At one testing site, they read your palm. So you have a palm scanner, you have an ID that's attached to you. You have to go and you got to take out all your
lockers too.
Your
right?
lockers, exactly. I don't know if anybody's ever been drug tested before, but when you go through a drug test, they will take all of your belongings you have on you and put it in a container that's locked, and then to make sure that there's no funny business going on exactly here. So all of the belongings and everything you have will be locked in a container. If you need medication, you have to let them know advanced and ahead of time so that they have that medication on you, and then they'll give it to you at the certain time interval that you need it. So there's 4 exams or like portions that you take. So there's about the biology and biochemistry portion, and that's 59 questions. So you have an hour and 10 minutes to take that one. And then you get a 10-minute break. Please take this 10-minute break. You want to be able to sigh, exhale, breathe, leave everything from the past. If you didn't do good on one portion, move on to the next one, and don't let that affect the remaining portion of the exam. So then you have the CARS portion, the critical analysis, reasoning skills. So that one is 53 questions, and that's an hour and 10 minutes, and you get another 10-minute break. And then you have the chemistry and physics portion, 59 questions, hour and 10 minutes. Then you have another 10-minute break, and you have the psychology and sociology portion, 59 questions, and then you have an hour and 10 minutes. Now this might switch, I think, depending on what you're going about, but this is just kind of like a basic example breakdown. Something to keep in mind, you don't want, will not penalize you if you get an answer wrong. So that's when multiple guess comes into play. If you're running out of time and you're stuck on this question, just multiple guess it and move on. And the exam you're able to go back and forth. So if you're like, I like to start at the bottom and work my way to the top, good on you, you can do that. This is different ways how to prepare for the MCAT. I just kind of put a whole bunch, or we did. Anarchy is one. Anarchy is a program you can download, and you can get files and put the files in or flashcards. Anarchy is really good because it will actually create statistics for you, and you can see what you're missing and what you're excelling at. And it also has, when you answer it, you're basically saying like, is this hard, is this intermediate, or is this easy? It's an adapted interface. Study sessions with others, it's always good to be able to go in study sessions, have someone teach you the topic, and then you go and teach them the topic. That solidifies what you learn. Practice exams, I went ahead and put jackweston.com. It's a website that has all the different portions of the MCAT. A lot of people like this for the SOSI section. They have the best, from what I read, material for the SOSI. And then rewriting your notes, that's what I've been doing. So like my physics class, I've been going back, and I have an iPad now, but then I used to write just paper notes, and I'm going back and just going and making it neat and going back and transferring that to electronic notes. For one, because I tutor. For two, because it reinstates that memory and refreshes. I went ahead and put in Princeton Review. They have I've heard that they're the best for the MCAT review books. Now, I've gotten a couple and I really do enjoy them, but overall, the community really appreciates them. They feel like those are the ones that are very highlighted in terms of the topics. High yield topics. So if you notice, I mentioned high yield. High yield topics are like, if a professor says, hey, I want you to make sure you remember X, Y, and Z, That's probably because it's coming up on the exam. So you can look and research high yield topics, and those topics that were brought up previously are high yield topics. Study sheets. There's lots of study sheets that you can find online. I know that in the Discord I have a lot of study sheets where you can go and you can find quick information. Kaplan makes a lot of them that are free that you just search online. Some basic advice is you want to study for at least 3 months in advance, like 20 hours a week for the MCAT, and it's intense studying. But you want to make sure that you have this big, like what Dr. Bergkamp said, are mile wide, inch deep.
Yeah.
The AAMC website, who actually you register the MCAT through, recommends that you do 240 hours over 12 weeks. Similar, that this is what I found, what most people worked with, and then what the AAMC offers. And the AAMC has a study sheet guide for you in terms of how to plan out your schedule, what to look for, so you can access that link there further and make a plan. They actually have a plan guide for you.
I would add to one thing that Jacob mentioned about the high yield topics. A good way to do that, because it can be daunting, if you're like, okay, what was my high yield topics for physics? Well, one suggestion, just get all of your old textbooks, go to the end of each chapter and look for those bold words. If there's a bold summary word and it makes you nervous, go back and study that. But those are going to be the high yield kind of topics for each chapter. And you can do that for your physics, for Gen Chem, organic, biochem, psychology. Yeah, so I do recommend that.
So this one's the most resources for the MCAT. So I make sure to go on and find study sheets, little quick sheet study guides. I made sure to find a whole bunch of free practice exams. The AAMC is now offering one free practice exam. So I would take advantage of that. That's opening up here pretty soon. Princeton Review has practice exams. Blueprint Prep is pretty established, and they offer free MCAT practices. And then also, the AAMC has their own official guide, which they administer exams. So that's pretty good to have their own official guide, because they're the ones, giving the exam. And then obviously for the CAP test or Kaplan, they have a little quick sheet study guides. You can sign up for email notifications for the MCAT. So I put that down there so you can go on there, and then they just send you, hey, update, registration opens. Because if you're updating, you have that, then it's frequently on your mind. And so maybe if you're putting it off, you're like, oh, maybe I shouldn't. Maybe I should go, test or quiz myself or go study. And then there's extra material. So those are podcasts. It's really good to get involved with podcasts that pertain to the MCAT. If you're on, I commute an hour to school, so I like to listen to podcasts. One of my favorites, I'm a Broncos fan, so I listen to Broncos podcasts, or I listen to MCAT podcasts, or I go back and review lecture material. So that's something that helps understand the MCAT. They give advice, and then also solidify those high yield topics, because they'll talk about those as well. And a lot of them are physicians that are hosting these podcasts. So they know a thing or two to take the MCAT, pass the MCAT, get into medical school. Yeah. One more, we have the fee assistance program. And then after that's the Discord. But the fee assistance program, real quick, I wanted to highlight it. I always tell everyone about this program. You can click the link and apply. It is very rigorous in terms of applying for it. You could see right there, they offer a lot of money off on prep material. The prep materials that they offer is free practice exam, free flashcards, free prep questions, and more. And that's $260 free that they give you if you apply for the program and they accept you. You get one free application submission, which covers up to 20 medical schools. And that's nearly huge. Almost $1,000. That's huge. That's a lot of money. That's good for you. And you have a reduced.
And you want to be applying to multiple schools. You don't want to only just apply for 3.
Yeah, exactly. Spread out your coverage, right? Because the more hooks you have in the water, the more likely you're going to catch a fish. Yep. They also have the reduced fee for the MCAT, which is the standard MCAT is $330. I know, crazy. But then they knock it down to $135. You get a 2-year subscription to the medical school admission requirements database, which all the medical schools that are registered through AAMC and they're accredited, you can go there and it's like a filter database where you're like, I have a 3.75 GPA. I want to go here in California, blah, 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 this and that. And they'll show you those schools that fit your criteria that you would want to go to. And it also has the AAMC preview professional readiness exam fee waiver, which this is like, if you're trying to prepare yourself to go into medical school and be, the professional, basically it teaches you how to conduct yourself, because now you're going to be a professional in the area. And so after that, that's just the Discord that we have. I offer the Discord for everybody. It's free. It has all this information and more. It has previous guest speaker presentations on there. It has individuals that took in the MCAT and wanted to present about the MCAT. So I highly recommend this. We have a great community. People post volunteer opportunities. I volunteer through Cope Health Scholar, and I try to advocate for that because that's good to get not clinical experience, but volunteer experience with patients in the hospital setting. So I highly recommend joining this and stop by and saying hello. And if you have any questions, ask. And we even have study groups on there to study for the MCAT and classes here on campus. Future people watching this, drop in the Discord, or you can email me at jroper1@csv.edu.
Awesome. Thank you guys so much. This was a really interesting presentation. Like, even though I'm a history student, I really did enjoy it.
Good deal.
I'm happy.
Yeah.